Reading the article, the systematic review of literature and examining mentors and mechanisms of change in EST treatment for PTSD, which is post-traumatic stress disorder. In this article, they are measuring the mentors and mechanisms during, before, and after treatment for PTSD. And in PTSD, there are many different treatments. The treatments providing cognitive processing therapy, eye mechanism of moving, and trauma-focused CBT, prolonging exposure. Those are some ways that we can treat PTSD. With PTSD, there's triggered trauma and events that had happened that we need to focus on. And with this article and everything, there was 2 coder screens and a code studies, which were given to 62 students that were identified and consistent with the mentor and mechanisms. They had reduced negative PTSD symptoms once they were starting this treatment, and then it was followed by between sessions and a decrease in their depression. When you look at the breakdown in the article of the percentage and everything, 47% measured before the outcome, and at least 3 times different measurements and everything. And then the 32% were growth, were curving within the models and everything when they were in the therapy and being treated. With this article, you're learning that how we address PTSD and how therapy tools can work and what the recommendation is for post-traumatic stress disorder. And within this, there's like the prolonged exposure, which is PE involves gradually confronting the trauma and the memories, the feelings, the situations, and the reduced avoidance and doing de-stressing. With the eye movement, stimulation is like the eye movement to help individuals process their traumatic memories. And then you have trauma-focused CBT and their therapy, where it combines cognitive and behavioral techniques, often with focus on, psychoeducation, relaxation, cognitive restructuring. And then, of course, with PTSD, there's also medications that are given, like SSRIs or SNRIs, to help manage the symptoms in the PTSD for the individual. And, when you're focusing on trauma and everything, you're addressing the event and the impact on the individual. And so with ongoing research, there's always exploring like new ways for PTSD and combining the psychotherapy and medication together. And, PTSD, when people think about it, is just like, when you're in the military and you're triggered and you see all these events. But PTSD can be affected with anybody that has a traumatic event and has these things. So like abusive relationships and health situations, for example, for me, like I was diagnosed with PTSD back after I had my ectopic pregnancy, and I had 2 of them. I was bleeding out. I was scared for my life. My daughter was there. It was very triggering for me. And the idea of getting pregnant again kind of triggers those things because, I almost lost my life twice within a 6-month period. And I was surprised I wasn't diagnosed more like recently, sooner than I did when I was with being a child. Like I was diagnosed with anxiety, but not PTSD, but I lived a traumatic life with multiple heart surgeries and going in and out and dying and all these things that should have been caught sooner. And so, they did put me on a medication that they use for PTSD, and I was put on like Wellbutrin, and that's just one of the examples of what medication can help with PTSD. I had to go into therapy, and I had to work on myself and manage what was being triggered, and not just in that health setting event, but also my relationship when it was abusive, and being triggered by certain things. Certain people say something and it gets triggered. So within this research, they're trying to combine different techniques to see what helps and what reduces that post-traumatic stress and depression, and what really focuses in on what helps each person. So in the study, they're doing it before assessment, they're doing during the assessment, and they're doing it after, to kind of get an understanding of what works and what doesn't, and what increases it and what decreases things. So that is my take on the PTSD and having treatment for it, with EST and everything. So thank you.